Hi, I'm Dr. Ravi, American Board Certified Director for Fertility Services. Today I'll briefly talk about my journey all along the assisted reproductive technology path and how this video is going to help patients at large, couples who are planning to have a child of their own, and the professionals who are going to be qualified as clinical embryologists and what their roles would be and what the future is in the IVF arena. So I started my career as a clinical embryologist way back in the late 80s, and I was very fortunate to be associated with the team which gave India its first test tube baby. So I was very fortunate to be under the leadership of Dr. T.C. Anand Kumar, Dr. Ravindra Dr. Jatin Patel and Dr. Jatin Shah, Sanjay Patel, and Rajmi Mehta. My journey started off here, and we started the first clinic, which was in the name of Hope Infertility Clinic. And then Dr. T.C. Anandkumar wanted to go pan-India. And during the course of this journey, I was in Delhi and then a couple of other places in the north. And that is when I got an opportunity to move to the Middle East. And from the Middle East, I was there setting up the first center for a huge medical healthcare conglomerate. And from there, got an opportunity to go to Japan, and then from Japan to Australia, to Monash and University of Monash in Melbourne, and from there to UK, the University of Warwick and Coventry, and then later on at the University College London, and then to Spain and Brussels and Germany. And I was very lucky to be with the pioneers as the journey of assisted reproduction took off. And then finally, I immigrated to Canada to do some research work on in vitro maturation. I'll talk about this as I go through the video. And finally, got into the US, the United States, to clear my, to achieve my American board certification. And that was when I got an opportunity to come back, relocate to the Middle East to start up the first of its kind IVF center in the whole of GCC. And then we kept base there and then started to take over clinics in different parts of the world. So this is briefly what I've done in my career. So I shouldn't be talking much on this, but the entire video should be focused on couples who are looking for achieving the dream of having a child, and to professionals who would want to be clinical embryologists or IVF scientists in helping couples, achieve or fulfill the dream of having a child of their own. So basically, what is infertility? Everybody keeps hearing the term infertility, childlessness, and couples who are longing to have a child after 2 years, 5 years, 10 years of marriage. So the concept of infertility is not new. It's been there since time immemorial, but just that the technology is now available to overcome the shortfalls of reproduction. So infertility is whether it was actually a dilemma to whether to classify this as a condition or a disease. Until recently, WHO has classified this as a disease, like obesity has now been considered as is being considered as a disease and not a condition. So what is infertility then? As defined by the WHO, infertility is a problem of the male or the female reproductive system, and is defined as the inability to achieve successful pregnancy, 12 months or more of repeated unprotected sexual intercourse. It's a global crisis affecting millions of people, and approximately 1 in every 6 couples will experience infertility, or individuals will experience infertility sometime or the other during their lifetimes. So what's the incidence? Initially, the blame was put on the female partner, but it's actually equal now if you look at it. See, WHO statistics show that 30% comes from the male, 30% female, 10% combined, and you have 25% which is unexplained, and 5% which goes to others because in terms of lifestyle, environmental issues, and things like that. So in the ladies, basically, the infertility is related to a kind of ovulatory problems, which could be because of a condition called polycystic ovary, and there is also obesity, which plays a very crucial role. hormonal imbalances, and the poor ovarian reserve. And in addition, you have tubal blockages because of endometriosis and sexually transmitted diseases and some uterine abnormalities. In the male, predominantly it's because of sperm parameters which are very poor, which are suboptimal, and which is not normal because of poor morphology, very poor sperm counts, motility, and things like that. And in addition to that, you have varicocele, trauma, sexually transmitted diseases, obesity, and diabetes, the biggest culprit, which is the underlying cause of male infertility in many cases. And add to that, you have hormonal disorders and genetic disorders, which are contributing to this. So there are two types of infertility. One is primary and secondary. Primary infertility is failure to achieve pregnancy by a couple at the first instant itself. Could be 1 year, 2 years, 3 years, 5 years after marriage. But the secondary infertility is the couple is able to conceive on their own, but the pregnancy doesn't last long. So there is some kind of an underlying cause. That's when they come to a fertility clinic, and the entire team of clinicians and reproductive biologists and scientists, help them achieve the dream of having a child of their own. So this is actually so what are the types? I explained the types. So now we need to know what are the risk factors involved. Excessive alcohol consumption by both partners, and then excessive addiction, or rather addiction to smoking, and with exposure to environmental toxins, infections, advancing age, and and obesity. Major causes are risk factors. So who are those people whom we have to target? In the Western world, by and large, there are a lot of people who come into an IVF setting, unlike India, where people will come to an infertility clinic after marriage and then they try conceiving, and so when they don't conceive 2 years or 5 years after marriage, there's a lot of pressure, social taboo, and pressure from both the parent sides and the in-laws and society at large. So there's a lot of psychosocial effects in India, and studies have shown that 47% of these infertile couples don't even want to go to attend any social gathering, and 16% want to avoid friends, 13% don't want to attend any family functions, and 10% wouldn't want to even meet friends, and just about 14% is considered as normal, and they would want to live their life without a child. So then what are we going to do? Who are this population? I mean, which percentage of this population is we are targeting as infertile couple, and what we do at fertility centers? So a wide variety of people, including heterosexual couples, same-sex partners, people who are not in a sexual relationship. I think it's catching up in India, this concept. And some people with medical conditions such as HIV serodiscordant patients, cancer survivors, same-sex partners, single parents rather, and many people who would want to undergo a sex change surgery because of their sexual orientation is again becoming very popular in India, would require infertility management and fertility care services. What is now coming new is the concept of fertility preservation among women who would want to preserve their oocytes, and rather the eggs as it's commonly called, and then would want to undergo a fertilization with a partner, whether married, not married in the Western world, at a stage when they're comfortable that they would want to bear a child. So it's becoming increasingly popular among the Western world, where women would want to achieve greater heights in their careers, and then followed by having a child, and so on and so forth. So briefly then, what happens everybody who's listening to the video as ladies would need to understand that the fertility decreases as the chronological age increases. So what is the odds of conception as the age advances for women? 20 to 25, then 25 to 30, 30, 35 to 40 years, you see that the chances of conception, or the odds of conception within 1 year of marriage, decreases from 85% when they're 20 to 25 to almost 75% when they're 30, and then it falls off, and just tapers down as they go advanced in the ages of 35, 40, which goes down to about 66 to 44% as the age goes, and as the women touch their 40s. So many a times, now girls attain puberty very early in their age, and then also they go premenopausal, they become premenopausal and menopausal very soon. And if they're going to push the age to about 35, 40, the odds of conception is going to be very, very poor. So next, everybody should understand why should we know what is a fertility rate. Fertility rate is basically defined as the average number of babies which are born to women during their reproductive ages. That is between 25 and 27. Studies have shown that there's a drastic fall from 3%, 3 to almost 2 now. The current rate is just under 2. All we need to look at is, as per the biostatisticians, is like you need every population needs to have a rate of 2.1 to keep a beautiful or a stable size of the population. Because this is 2.1 is just a statistical misnomer. It should be 2, because a couple as male and female should replace themselves by 2 people, another boy and a girl, so that the population is replaced. So that's the logic behind this. So again, now, after briefly talking about all this, why is there so much of demand? As I said in my introduction itself, one out of every 6 person is going to experience infertility. So that's the crux of the issue. So more and more centers are going to come up, more and more studies are going to happen, more and more research is going to be conducted to see how to circumvent this problem. So the current data says that, as it's revealed by the WHO, only under 1 million babies are born out of IVF, while the exact demand is almost around 12 million. So the gap has to be bridged, and the secret of bridging the gap lies in the IVF lab, where the eggs or the oocytes and the sperms are brought together or fertilized to give an embryo, a healthy embryo that, when transferred into the uterine cavity, leads to a healthy pregnancy and a take-home baby. So how's the scene in India? It's a booming market in India, currently estimated at about $364.6 million US dollar market as of 2024. As per the IMRAC study, it's going at a steady rate of 15.4% year on year, and between 2025 and 2033, it's expected to grow at 15.4%. And by the time we reach 2033, the entire IVF market in India was probably going to reach $3.4 billion. So that's the demand, and that is where there's going to be scope and place for more players in the market, and more people will be trained and to become embryologists who will be closely working with the infertility team, because infertility, by and large, these assisted reproductive technologies are basically 85% to 90% lab-based, where you have clinical scientists working in tandem with the clinicians. So unless and until you have a good embryologist or a good andrologist, a good person who's going to freeze the gametes and embryos, along with the clinical team, the success rates are going to be very low. So it's very important that we take a look at the PQR, professionals, qualification, and requirements. That's one of the reasons that I've come back to India to contribute myself into establishing these academies, because the ART, or the Assisted Reproductive Technology Act, was passed in 2022, and it clearly states that the centers have to be licensed, the professionals have to be licensed, and they have to be licensed as clinical embryologists, not licensed, they have to be certified. India doesn't still demand licensing for these reproductive biologists, but they need to be qualified, either having an MSc for freshers, masters and PhD or higher, and at least a postgraduate diploma for people who have already grandfathered. That is, people who have already been working for more than 5 years in the field of infertility. So this brings me into another area of having infertility education. So this is what it is in terms of infertility, the professionals and the patient's perspective. But coming to what are these assisted reproductive technologies, there's beautifully coined like IUIs, IVF, ICSI, so on and so forth. But I would say this controlled ovarian hyperstimulation is the basic. Then you have intrauterine insemination, wherein when the lady's got patent tubes, her anatomy is normal, we only time the fertilization by using preparing the husband's sperms, which is slightly suboptimal bring it, make it optimal, and deposit at the site of the fertilizer, ensure that the conception happens within the body of the female. And if this fails, and probably when there's a blocked fallopian tube, we'll have to go on for an IVF. And then there are a lot of other technologies like injecting the single sperm into an egg, which is called an ICSI, intracytoplasmic sperm injection. And then we also have the ability to freeze either gametes or embryos, that is sperms, oocytes, or the blastocysts that are formed after fusing the sperm with the egg. So this is all about infertility and all the acronyms that are used in an IVF setting. And then comes the fertility preservation, where you can even freeze sperms, eggs for as many years, but then within the stipulated number of years as laid on by the law of each and every country. So for further information, probably you can get in touch with any of these fertility centers, and I would be also happy to help as many people as possible.